According to Medicine Plus, metabolism is the process your body uses to get or make energy from the food you eat. If this is all that happens, then there's no trouble at all. However, complications begin when some chemical reactions disrupt these natural processes. When this happens, you are said to have a metabolic disorder. Sadly, some metabolic disorders are genetic, which means you inherit them. According to WebMD, inherited metabolic disorders are genetic conditions that result in metabolism problems. Most people with inherited metabolic disorders have a defective gene that results in an enzyme deficiency. In today's video, I'm going to tell you about 5 signs that may indicate that you are having metabolic problems. Once you notice any of these signs with yourself within your body, please check in with a doctor. Do not self-medicate because you may make this problem worse. And you could always get it wrong. After all, you're not a professional. If you're new here, consider subscribing and click on the notification button. That way, whenever we have new content, you will be notified. Alright, let's get to it. Number 1. Excess fat around your waist. Now I know what you're thinking. The love handles. Well, we're not going to look at it from that angle today. Do you have excess fat around your waist? I hope not. According to Anna Cassell, endocrinology medical practitioner, carrying excess fat around your waist in particular is a large risk factor. This means at least 35 inches in women and 40 inches in men. If you have this condition, you should probably seek medical attention as soon as possible. These things are usually okay until they're not. That is to say, you feel okay having that fat around your waist. You feel fine. You don't feel the need to go to a hospital. However, by the time you start feeling some severe or major discomfort, it might be too late. So don't wait until something happens before you go for a checkup. Number 2. Increased blood pressure. These days, finding out your blood pressure is no longer as difficult as it was before. There are many devices available that you can use to find out your blood pressure without the support of a medical practitioner. Now this one, we wouldn't really call it a self-medication process. It's more or less professionally aided self-medication process. I know, it seems like a loophole. But these devices were well crafted and well recommended by a variety of health professionals. In fact, they are backed up by the major health corporations, so why not? Some of these devices include Withings, iHealthSense, and CoGeek. I hope I spelled those correctly. If you have increased blood pressure, this is a sign of metabolic disorder. If your metabolism was fine, your body would have digested all the fats that are now accumulated around your waist area or any other part of your body, which leads to, higher blood pressure. Typically, people who are already this way will find it hard to move around very quickly. One of the best ways to avoid this is by eating a balanced diet and exercising very often. Number 3. Elevated blood sugar. This is another sign. We are concerned when your levels are above 100 milligrams per deciliter, according to Anna Cassell once again. In addition, Mayo Clinic has stated that having diabetes increases your chances of having metabolic disorders. If you are not sure about any of these signs, please do not hesitate to contact a medical doctor. Mayo Clinic also outlines risk factors that we think you should know about. A few of these risk factors are age. When you are older, the chances of your metabolism disorder increases. Another risk factor is obesity. When you are obese, the chances that you will have this disorder also increases. Yet again, ethnicity. If you are from a particular ethnic group, it may increase your chances of having this disorder. Mayo Clinic reports that Hispanic women in the United States have the greatest risk of having metabolic disorders. Another risk factor are, other diseases. You see, some diseases can initiate the concept of metabolic disorders in your body. For instance, a non-alcoholic fatty liver disease can increase the chances of having metabolic disorders. Number 4. High triglyceride levels. You cannot actually notice this one on your own. This isn't like the, checking your blood pressure levels with specific devices. At least I don't think we're there yet. The hospital can find out though, through a test of course. Now these tests determine the quantity of fat in your blood, and when it is above a certain level, it becomes a clear sign that you are at the risk of having metabolic disorders, assuming you're not already experiencing them. Number 5. Chronic or persistent diarrhea. This is also a sign of a metabolic problem. However, take note that there are other things that may cause similar symptoms. This is another main reason why we do not advise self-medication. According to HealthGrade, alcohol abuse is one of the causes of metabolic disorder. This is not very surprising. Alcohol abuse is mostly associated with liver failure, stomach upset, and a variety of other ailments. Alcohol is great when it is a glass or two. However, people who abuse alcohol typically take alcohol in order to escape the reality. If you feel depressed, please don't resort to alcohol. Talk to a friend or take a walk, buy a dog, do anything other than damage your body. A metabolic disorder is not something that's pleasant for anyone. You can avoid all the challenges that come with it by exercising frequently and eating a balanced diet. For those of you that inherit this due to your ethnic group or ancestral lineage, there's really not much you can do, but it is still a great step to take these tests regularly so you can have a better chance at detecting these signs early. And if you know that you are open to it, if you're Hispanic or any other ethnic tribe, you can take the necessary steps to better manage yourself. In summary, eat a balanced diet, stay off a lot of alcohol, and exercise regularly. Do these 3 simple things and you will be just fine.